Welcome, everyone, to the session that is titled Co-Developing the Vaccine Research Agenda in British Columbia. My name is Sterling Bryan. I'm the Chief Scientific Officer at Health Research BC. So in this session, there will be a live question and answer after the presentation. So please use the Q&A feature that's at the bottom left-hand corner of your screen to ask questions to the speakers, and we'll have a Q&A session once the presentation has finished. Please use the hashtag PPF2022 in your tweets about the conference. And for any technical questions, please go to the technical support that can be found to at the bottom of the menu on the left within the conference platform. I'd like to welcome Beth White, Sabrina Gill, Manish Sadarangani, Alistair McAlpine, Reka Gustafson, and Caitlin Watson. And I'll now pass over to Manish, who's going to start with the presentation. Thank you.
Thanks, Sterling, for that introduction. And I just want to thank you and the organizers of the conference for inviting us to share some of the work that we've been doing over the last 2 to 3 years in British Columbia around vaccines, which now is very topical, and we started this when it was a little bit less topical. So I'm just going to start with a few slides just to introduce and orient people to the project, and then we'll go into a Q&A session with the various panel members who I'll invite to introduce themselves in a few minutes. But we really do want to hear questions from you all, and so please put your questions into us, and we'll try and include as many of them as possible in the conversation today. And we really do want this to be a sort of a conversation rather than us just being here speaking to you. So I'm going to pull up my slides here. So as Sterling mentioned, the title of this is Co-Developing the Vaccine Research Agenda in British Columbia. And we really started this project back in the fall of 2019. So, before COVID was on the planet, before anyone, knew what that was going to bring to us. And it's really spanned this very interesting 2 years that we've all lived through. The members of the panel have been mentioned already, but I just do want to also acknowledge the funding for the project that we're going to talk about was provided by Michael Smith Health Research BC. I want to acknowledge that I'm based at BC Children's Hospital Research Institute, which operates on the traditional, ancestral and unceded territory of the Coast Salish peoples, including the Musqueam, Squamish and Tsleil-Waututh nations. And this acknowledgement and gratitude and respect extends to all of the Indigenous communities on whose traditional territories we work, learn and build on. So I just want to give you a bit of a background to the Vaccine Evaluation Centre. So this is a research group based at BC Children's Hospital. I'm the director of the Vaccine Evaluation Centre. I should probably introduce myself properly. I'm a paediatric infectious disease physician at the hospital here and as a director of the VEC. So this was established over 30 years ago now as Canada's first academic centre for independent vaccine research. And over that time, under the leadership of mainly of Dr. David Shifley, who is the founder of the group, has become an international leader in vaccinology research, and I've been very privileged to be in this position now since 2016. We're sort of at that operating across between BC Children's Hospital and the University of British Columbia, but we have very close affiliations and collaborations with many other researchers, public health partners throughout BC, across Canada and internationally. And while I'm a pediatrician, our projects span across the age spectrum. And our research includes laboratory science, clinical trials, epidemiology, social science program implementation, and surveillance. So really across the entire breadth of vaccine research. Just also want to this audience probably doesn't need introducing, but just to make sure that we're all talking the same language, just sort of how we're looking at some of these terms. So just to briefly provide some definitions. So when we talk about knowledge translation, we're really talking about a dynamic and iterative process that includes synthesis, dissemination and exchange, and ethically sound application of knowledge to improve the health of Canadians, provide more effective health services and products, and strengthen the healthcare system. And research uses user or a knowledge user is any individual who is likely to be able to use research results to make informed decisions about health policies, programs, practices. So that may include a practitioner, a public health policymaker, an educator, or members of the public themselves. And so all of these are really critical people in terms of the research that we do. At the end of the day, if no one's using the knowledge we generate, then the whole thing is kind of a waste of time and a waste of effort. And so when we came together to think about vaccine research in this lens and how this looks in BC, really was very obvious from the beginning that this needs a multifaceted collaboration, and there's a lot of listening and learning that needed to be done. Historically, most vaccine research has been designed by researchers without full engagement of the public, of healthcare providers and policymakers. And while some research has involved these groups, they're not involved all the way along. And so we started in the winter of 2020 with a face-to-face World Cafe workshop. We had public representation, patient groups, clinicians, public health individuals, policymakers, decision makers. Dr. Bonnie Henry was there, and we held a series of discussions with all of these people to try and identify and prioritize knowledge and evidence gaps relating to vaccine research. We then had a little bit of a delay in the next phase of the timeline because of the interruptions due to the pandemic, but in fall of 2021, we went on to have key informant discussion groups to discuss further with these groups, as well as others, including, for example, representatives from the Black community, the South Asian community, etc. And so where we are now in this project is really, we've identified a few messages and a few themes have come through from the conversations that we've had. So there's still, the importance of collaboration has really been highlighted over and over again, and it's been highlighted that there's still a lack of collaboration with research users and other partners, including Indigenous populations and vulnerable youth. The knowledge that is needed, and there are gaps still there in the public and healthcare provider knowledge on vaccine development, and particularly focusing on some special groups who have a need for vaccines, such as pregnant people, people with medical complexity or immune compromised patients. There's still a feeling from many healthcare providers that dissemination of accurate knowledge is not as effective as it could be in terms of receiving information around vaccines, which is very clear, very trustworthy, avoiding some of the conflicting messaging that we've seen. And some of that is due to evolving science or different interpretations of the same science and that. But all of this can contribute to vaccine hesitancy and loss of confidence in vaccines. And then the other issue that came up is surveillance. And I think, as we know, we live in a country which is divided up into many provinces and territories. And so people sort of highlighted the importance of having a national system in place to monitor vaccines, vaccine confidence, vaccine safety, and vaccine efficacy. And so the messages we heard from the conversations that we had was that we needed to establish a diverse and inclusive group of stakeholders to be informing vaccine research and knowledge translation, but right from the beginning of the process. So not after you've done the research of how to translate it, but really in the design of the research and designing the questions. Conducting a scan of available resources for all age groups, including children, to identify where the gaps are in terms of knowledge translation, and co-developing research proposals. And on that last one, it's really around developing an evidence-based approach to vaccine education for both public and healthcare providers, looking at safety and effectiveness of COVID-19, but also other vaccines and these sort of specific groups who are sometimes excluded or come in late to clinical studies, such as people with immune compromise, improving our understanding now, mRNA vaccines and other novel vaccine technologies and platforms that we're going to see, and improving national surveillance and monitoring for vaccine safety, efficacy, and confidence. So that gives you a bit of a very high-level overview and introduction to some of the conversations that we've been having. I'm now going to just sort of talk you through and introduce, or ask the panel members to introduce themselves. And so I'll start off is to ask Caitlin, maybe do you want to just introduce yourself, Caitlin? You're muted.
We are off to a great start. Anyways, as I was saying, my name is Caitlin Watson. I am a former BC Children's Hospital patient. And while it has been a few years since I officially aged out of pediatrics, I've been lucky enough to stay involved with the hospital in a bit of a new capacity. So as of right now, I am a member of the BC Children's Youth Advisory Committee, also known as the YAC, which is how I know Sabrina Gill and is ultimately how I've come to meet and collaborate with the rest of this panel. In addition to the YAC, I am also a member of the BC Children's and Women's Pain Committee. And for just under 3 years, I've been quite heavily involved in the process of overhauling the hospital's pain management policies and standards of care as part of the requirements for hopefully becoming a Child Kind certified institution in the next few months. When it comes to vaccine research, actually really just research in general, I am quite new to all of this. The majority of the research that I have started to become involved in recently is mostly related to pediatric pain, and specifically how children, youth, and their families experience the biopsychosocial impacts of pain. And again, when it comes to vaccine research, I am by no means an expert, but I've been very happy to use my voice to promote patient engagement, and specifically youth engagement within vaccine research. And for this project in particular, I took part in the initial collaborative workshop at the beginning of 2020, as well as one of the stakeholder focus groups this past fall. I've also had the opportunity to take part in a discussion between the YAC and some public health officials to talk a little bit about how to guide the COVID-19 vaccine rollout for the 12 to 17 age group. And really just to help ensure that the vaccine clinics would be youth-friendly. Well, I'm sure the last 2 years have been a lot for the research community. I'm so glad to see that patient engagement is remaining a priority. And I'm honored to be here today to share the youth and patient perspective. So thank you for having me.
Thanks, Caitlin. I think, just to say, as Caitlin's highlighted, she's been involved in this from the beginning. And I think I've really enjoyed all of the conversations that we've had with you and other people from the YAC, and have learned so much from you over the last couple of years. So just really thank you for your engagement and enthusiasm. So next, that brings us nicely to Sabrina. So Sabrina, do you want to introduce yourself?
Yeah, thank you. And thank you, Caitlin, for sharing that. I'm Sabrina. I'm the nurse clinician for the Division of Adolescent Health and Medicine here at BC Children's Hospital. I'm also enrolled with the UBC Masters of Health and Leadership Policy program with a learning focus of equity, diversity, and inclusion. Our team here, we strive for youth-friendly care practice, focusing on positive youth development and resilience and health equity for adolescents who experience marginalization. And as Kate mentioned too, Caitlin, we take a lead in the YAC, which creates opportunities for youth leadership engagement at the hospital here. So I'm really glad to be here with Caitlin. Thank you.
Thanks, Sabrina, and thank you for connecting us all to the great group you have at the YAC, and for being such an incredible advocate for vaccine research and for evidence-based decision making at BC Children's Hospital. So thank you. Next, Rekha.
Hi everyone, I'm Rekha Gustafson. I'm a public health physician and I lead the BC CDC at this time. Used to be a frontline medical health officer for many years, and in that role, and in the current role, I'm often involved in decisions about which vaccines to whom, when, where, and how. And I also have the opportunity to speak with and learn from groups of people such as schools and teachers and parents. And so I'm often a consumer of vaccine research. It helps make our public health clinical decisions, and it's really, really important. And as such, I'm also aware of the gaps in research, and in particular, I think the gaps that I'm aware of are things. What are the meaningful outcomes for patients? What is a benefit? We measure benefit in terms of reduction of a rate of disease, but really, what is a barrier? What makes it easy to make a decision about vaccines, and what makes it difficult to make a decision about vaccines? What makes it easy to get a vaccine versus make it hard to get a vaccine. So a lot of, again, in sort of in that primary or the vaccine science, I'm a very grateful recipient of research of people like Manish about the medical and scientific benefit of vaccines, and hope to learn from this panel and participate in that other half of vaccine science, which is really the implementation science, and in particular, how to move from a place where people who are getting vaccines are fitting into our system. How do we fit vaccines effectively into people's lives? Thank you.
Thanks, Rick. And I think, to be honest, Caitlin, Sabrina, and Rick are the most important people here today, because these are the people who, you know, the research is done for and need to be able to use it. And from both an individual level that we have here at the hospital, right up to that population level that Rick is dealing with. So, and I just really so pleased that we've been able to get everyone together, not only on this panel, but throughout this whole project. Getting everyone in the same room together to talk has been, whether it's a virtual room or a real room, has been really truly remarkable. And I think says a lot actually about the individuals that are willing to actually also step up and have those conversations. And Reka and her other colleagues in public health have just been incredibly collaborative, actually. And I think also when it comes to vaccine research, it's amazing that some of the things that I would have found interesting, or I found interesting, like, you know, what should the interval be between doses, and what happens when you mix and match vaccines that 3 years ago no one would have cared about. Now everyone wants to know. So it's really exciting time actually for vaccine research. So the last person on the panel I'm going to introduce you to, or he's going to introduce himself, is Alistair McAlpine, who has been co-leading this project with me from the beginning.
Thanks very much, Manish. Hi, everyone. My name is Alistair McAlpine. I'm, like Manish, a pediatric infectious diseases doctor. I have a special interest in vaccines. I always have, and I also have a special interest in social media and how we disseminate information. And I've been very lucky that Manish approached me quite early on and was like, hey, Al, I got this really cool idea. Would you like to get involved? And I jumped at it with both hands. I don't think we expected it to necessarily take as long as it did and to go the twists and turns that it has. But I've been very privileged to work with such a great group of people, to work with Dr. Sadarangani. And I feel like I've really learned so much during this process. And I'm excited about chatting about it now and about where we're going to take it. So yeah, that's about all I have to say about me. And I'm really looking forward to this discussion.
Thanks, Alistair. So I am going to, without any further ado, because we actually want to get on with the questions piece. So I'm going to stop slide sharing and hand over to Beth White, who can introduce herself, and then we'll moderate the rest of the Q&A this morning.
Perfect. Thank you, Manish. So I'm also very excited to be here today. My name's Beth White, and I am a knowledge translation coordinator at the Vaccine Evaluation Center. So I did not start at the very beginning of this project, but I came in about 8 months or so ago, maybe a little less, to support sort of the second half of this project and hopefully be a huge support as we move forward with this work. So today, incredibly excited to learn from all of our panelists. And just to explain briefly the format, we do have some set panel questions, but we also really want to hear questions from the audience. So please do, as Sterling mentioned, add your questions to the Q&A, and we will try to get to as many of them as possible. So to jump right in, right now, most vaccine research is done without the expertise of the public, without policymakers, without healthcare providers. So Caitlin, this question's for you. What impact has the lack of engagement with research users had over the last few years?
Yeah, so I think when it comes to vaccine research, the lack of engagement with research users has really been one of several factors that has contributed to the mistrust and vaccine hesitancy that we're seeing more and more frequently within the general public. Over the last few years in particular, I think there really seems to have been this perceived lack of transparency within vaccine research. And I think a lot of that stems from the fact that many people just aren't fully aware of the process of research. They've never seen it before. They've never seen the whole process. And, for a lot of people, the only part that they do see is when the results of a study are condensed into a single headline on the news. So of course, when you add a pandemic and, vaccines are becoming so heavily intertwined with politics, and they're being developed at this incredible, but kind of unheard of rates, it totally makes sense that people are experiencing this lack of trust in the whole research process. That being said, I do think a critical step in trying to regain that trust is to increase public engagement within vaccine research. When we allow people to play a more active role and see the whole process firsthand, we help them understand that constantly evolving information doesn't mean the public's being lied to, or that researchers don't know what they're doing. It just means that they're constantly trying to learn more in order to keep us safe. And I think the more that vaccine researchers can help the members of the public feel like their ideas, priorities, concerns are being heard and taken seriously, the more we can really rebuild that trust.
Furthermore, with Caitlin, thank you, Caitlin, for sharing that. Engagement is about inviting the process, not about us, without us. And with that voice, it gives perspective and creativity to optimize the quality of the research too, which is so important. And when we reflect on some of the projects that have that youth voice, for instance, for the YAC, they're the most impactful projects for patient care, and also end up winning awards compared to projects that don't have that engagement piece. So that's really important to highlight, and that is a loss of opportunity if there's no impact from the community.
Perfect. Thank you, Caitlin and Sabrina. Yeah, absolutely. I think you bring up such an important point about mistrust, and we often talk about knowledge translation in terms of closing the gap between research and what's done in practice, and engaging patients and engaging research users is such a big piece of that. So thank you for highlighting it. My next question is for Reka. So Reka, how can co-identifying vaccine research needs improve immunization programs?
Thanks very much. I think if we identify the research priorities together, we can actually answer the questions that communities and individuals have that specifically address the things that go into their decision-making about vaccines. We make a lot of assumptions about what people, how people make decisions about vaccines. And I think the last 2 years, when you look at sort of the geographic variation of how people's uptake or people's use of the COVID-19 vaccine, there was clearly more to the story than sort of the effectiveness, efficacy. There were differences in geography, there was differences in age, there were differences in ethnic groups or cultural groups and there's really different reasons that people make those decisions. And so to me, the co-creating the research questions with communities and with individuals would really help us make sure that we're not continuing to research the questions that we have set and answers the question that we have, but actually research the questions that make a difference for people. And for me, that was especially true in the last 2 years, where we were making decisions so rapidly. And I was just constantly conscious of the assumptions that we are making. And maybe it's, one of the most common ones is you may ascribe a decision not to take a vaccine to a complex set of fears about the vaccine, and it may just be that the clinic isn't open at the right time, or that there is a significant concern about the way that the research was actually presented to us. So I think the biggest thing is that we need just, and I always feel strongly about this in research, is that unless you've set the question up right, really there's a lot of potential for possibly wasted effort.
Perfect. Thank you. I really like that framing of to set the question up, right? So Alistair, very similar question, but how can co-identifying vaccine research needs specifically improve clinical practice?
Yeah, thanks for that. So we know from research that the number one factor that provides the public, members of the public, with confidence in vaccines is a clinician providing them with sound, correct, and accurate information and allaying their fears. And the only way that we're going to get clinicians to do that is if they themselves actually buy into the process. And I think we only get them to buy into the process by making them feel involved and making them feel like their concerns or their questions are being answered, or the stuff that they see on a day-to-day basis in the wards and in their clinics and in their practices are being addressed by researchers and not being ignored by the so-called ivory tower folk. So it's crucial that we get clinicians on board, and we can only get them on board if they buy into the process. And it's clear that we know that there are gaps in clinicians' knowledge. They have told us as such that there are patients, there are situations that they themselves do not feel comfortable with. And it's crucial that if we're going to get them to support the vaccine drive, to support vaccination for their patients, that we identify what they're not feeling comfortable with, the questions that they have, so that we can get them on board. Because if we lose clinicians, and if the clinicians start to doubt the process themselves, we lose an absolutely crucial cog in all future vaccine efforts.
Thank you, Alistair. Yeah, that's during some of the discussions we had, that is a piece that came up often, is that patients are now coming with a lot more information, especially during COVID. And so there's still gaps that clinicians have in knowledge. So addressing that's important. I just want to remind everyone that you can ask your questions using the Q&A button. So that's located on the bottom left of the platform screen. So we're happy to answer that throughout the panel as well. So no need to wait till the end. Please feel free to throw those into the chat now. So taking a look at co-developing vaccine research and what this might look in practice, we realize that there actually is a very wide range of what vaccine research looks like. Manish mentioned a lot of the research that we do at the Vaccine Evaluation Center. So, you know, this is all the way from laboratory sciences to clinical trials. We have program surveillance, looking at social sciences, vaccine hesitancy, and building vaccine confidence. So this is such a huge range. And so Sabrina, this question's for you. And how can patient or public partners really support this range of vaccine research?
Yeah, there is a range, including how partners can support, from community networks, agencies, to that one single voice. Having the awareness that every support and voice counts in the vaccine research will build up momentum of their engagement. It's our role as healthcare professionals and researchers to ensure that those voices are heard. And what comes to mind is a strength-based model and the storytelling through lived experience. A question to ask is, where are those voices going to be the most impactful in vaccine research? We need to ask the public partners, because we really don't know where they want to contribute unless we ask. I think of our youth advisory. Some youth like to focus on policy and advocacy, and other youth enjoy strategies, creativity of knowledge translation with a youth-friendly focus. And we had one younger youth, and what they wanted to focus on was Mythbusters, which is such an important concept for our population. Overall, it's finding that connection where they feel they can give in a meaningful way, which is a key for empowerment and engagement. So there is so many various ways we need to ask.
Thank you.
Yeah, and I just want to jump in and quickly add something. I feel like quite often when we talk about patient or public partnership within healthcare, most of the focus seems to be on the benefit that patient or public perspectives bring to research or healthcare delivery. But something that I think should be talked about far more often is the benefit that these partnerships have on patients and members of the public. Obviously, I can only really speak to my own experience, but for me, taking on more of a patient partner role has been kind of life-changing. I know that sounds a little dramatic, but it's true. As a young person, and specifically one that has dealt with a lot of health challenges, I think it's really easy to feel powerless. So being able to turn my lived experience into advocacy work and to actually have my voice be heard is huge. It's incredibly empowering. And when I'm able to see my work and my experiences actually resulting in change, that motivates me to keep doing more. So, whether researchers invite youth to take part in workshops and focus groups, or, if there's an opportunity for collaboration to make youth-friendly resources or do some myth busters, these opportunities for engagement can really allow young people to feel valued and empowered and confident. It helps us build connections and develop advocacy skills, and it motivates us to keep speaking up and keep using our experiences and perspectives to help change things.
Thank you, Caitlin and Sabrina. Yeah, I think that's wonderful that you've had such a positive experience. And I think meaningful patient engagement definitely should have sort of that two-way benefit for you, and also huge contribution to the research itself. So that's wonderful to hear. That's been your experience. We do actually have a question from the audience that is relevant to this. So Paul asks, as a mixed race BIPOC person, can you comment on Indigenous and people of color in correction, and in terms of the representation in COVID and other vaccine research? Are we hearing their voices and best serving their needs? So I guess just to reiterate that question in terms of, do we have sort of a diversity of voices in COVID research, and how can, I guess, we better address their needs? Manish, I don't know if you want to take that one, or maybe Sabrina.
So I'm happy to start. I mean, I guess to me, there's two different elements to this. So one is around the sort of issue of Indigenous and people of color. So being involved and engaged in research is one question. And then it sounds like there's also a question around people in correction facilities. So I think these are two very, there's some overlap potentially, but there are two different issues. So I think that, this is clearly something that we identified in that first workshop that we did, that, I think there was a relative lack of some of those voices that was there, and that came through in a number of comments. And, once I'm done, Sabrina or Caitlin or others may want to comment on that further. There's some of those key informant groups that we had subsequently, and some of the research that we and others in BC are doing, and across Canada, there are specific research around COVID in Black communities, in South Asian communities as well, and those are the ones I'm aware of, and in Indigenous communities. But I think all of these, as with all of them, they have to be done in a collaborative and respectful way, as with everything else. And really, the questions need to come from the communities rather than from the researchers, and some of that takes time to build those relationships and those collaborations. And honestly, to build the trust, there's, years of mistrust with the system that kind of predates my being in Canada or any of us being involved in vaccines or research. And I think that we just need to acknowledge that and realize that and work with that. I think on the question around correctional facilities, so there is, I know that and I don't know whether Reka wants to speak at this, but BCCDC have been involved in COVID studies with people in correctional facilities. I'm not directly involved in those studies, so I can't say explicitly, how much that has involved kind of best serving their needs, I guess is a question, and that's why we're here having this conversation, because what researchers may think is in their best interest may not be what the individuals themselves thinks. And so I can't really speak to how they've been involved in developing the research projects, but I think that in the same way as any other group, I think that you do need to hear those voices, right? So I think it goes back to Sabrina's point about, not about us without us. And so I think that applies across any population you're talking about. And so I think the conversation we're having today, whatever the target population of a research project is, I think they should ideally be involved in that from the beginning and from the design of that research.
I can comment after if you like.
Perfect, thank you.
It's a good time?
Yes.
Okay, so I can just talk a little bit about that because we've had some COVID research done at a population level. We did a survey called COVID Speak Survey, and 400,000 British Columbians answered that survey, and then 200,000 in the next iteration. And I think that particular process illustrates, the steps that are required in order to make sure that populations are appropriately represented. First, you have to ask the question, and I think that's for like in any research study or surveillance effort. If you don't ask about race and ethnicity, you can't do any analyses based on race and ethnicity. So I know that sounds really obvious, but it actually isn't always asked. So that's the first thing. And then what happens, I think, in a lot of these ongoing research efforts is that then you actually have to make the effort to analyze based on those variables. So for example, with the COVID Speak survey, we did ask the question, and we had some Black researchers actually analyze the data, analyze the response that came from the Black community. And I think that was that was excellent because it combined the availability of data and then the effort required to analyze and interpret that data appropriately for people with either both personal experience but research experience in the area. So I just wanted to say, not we're far from perfect. In most of our surveillance data, we don't ask. We don't routinely collect race-based data. And so I think the way to make it happen is sort of, what are the steps in the research pathway to make sure that you actually make that conscious decision. And I think where we have, if I look back on COVID, certainly at the beginning, there were disproportionate effects in different cultural and ethnic communities. And that information didn't come to the decision-making table as rapidly or in as concerted a fashion as it should have. So we've got lots of gaps left.
Perfect, thank you, Rika. Yeah, I think there, at least in my experience at the beginning of this pandemic, collecting race-based data I'm coming from Ontario, so that was a huge priority there. But I think also that analysis and how that information is disseminated is also a really important part of the conversation. And there's tons of organizations that have developed resources to support that as well. Sabrina, I believe you also had a comment.
Sure. Yeah, it's about the community-based practice when it comes to the missing voices. And how we engage, right? As researchers, we need to build that trust, rapport, and relationships, and that takes time. So it's just, again, about the networking. And then as Rika mentioned too, we have to look who's on the team of the research. Is there a diverse, and as research shows, more diversity or in healthcare and research teams, that there is a difference in health disparities too. So it's just looking at the big picture. How do we include all voices? But the main thing is building relationships.
Thank you, Sabrina. Very important, building relationships, and as Manish mentioned, building that trust. So turning to some of our discussions that we had throughout this project, many people identified some needs, some research questions that have in fact actually already been answered by researchers. So what role do researchers have in responding to identified knowledge translation needs that go beyond their own research? Manish, if you want to touch on that.
Yeah, that's a great question. And I guess it's a difficult one to tackle, right? So I think it's, it's hard enough to keep up with the knowledge translation needs of our own research, I think, to actually make sure that we're one, getting the input on the research from the people who are affected by it, whether that's public health, people, policymakers, decision makers, clinicians, and of course members of the public and patient groups. So, we want all of them to be involved in our own research, ideally, from throughout the research process. So from the beginning in the design, doing the actual research, designing materials, consent forms, these sorts of things. And then at the end, when we have the results, how best to disseminate it amongst those groups. And that in itself is, almost a full-time job, and I guess that's how Beth, we created that position that you're now of having the knowledge translation coordinator, which is a new position which we didn't have, but I think we identified that as a real major gap for our own research. So then but as you say, a lot of the questions we had from people is, we think this is a research priority or whatever. It was, well, that research has been done by others. We think it's really good quality research and good quality data, and so we don't think there's any advantage in replicating it. So I think that's important to address those questions, actually. And I think that when it's relevant to the research we're doing, so if we're not doing a study because someone else has already done it or because somebody else is doing it, then I think it is important to also highlight that it's not that we're ignoring it, or it's not that we don't think it's important. It's because we know that it's either being done by a reliable group or reliable collaborator, or that it's already been done, and then these are the results they found. And oftentimes, there's research done by others, which will then lead to follow-up research that we will be involved in or we will do, and so it directly does link. And I guess that the other piece is, as part of research training that researchers have, as part of healthcare training that a lot of clinicians have, we do get training in how to read, interpret other people's research. And so I think there is also a role there in trying to provide that interpretation, again, in a way that is meaningful to the end users. And, some is easier than others. So when you have something like a clinical trial of a COVID vaccine, which shows efficacy of 90%, as we had with the mRNA vaccines at the beginning, that's, those were very, very tightly designed. They highly regulated by Health Canada, by the FDA in the US, and so they have to be done in a very prescribed way. And so you get some relatively clean results at the end that is pretty easy to explain to people. What gets more difficult is when you have, some of the groups that we've talked about, like say pregnant people, where at the beginning we were talking about small studies with small numbers of people, and they're all done in slightly different ways, and none of them give you a definitive, clear-cut answer, and then trying to put that together is more challenging, and that's where you will get some subjectivity potentially comes into it, and some, differences in interpretation between different researchers, different healthcare bodies, and that's where you start to get a little bit of this confusion that we talked about earlier. So I think some is easier to do than others, I would say.
Perfect. Thank you, Manish. So we also, in terms of things being more complicated, we often use the term patient-oriented research or patient partners. But when it comes to vaccines as a public health intervention, it's for the whole population. So, includes healthy individuals all the way to medically complex patients. So Rekha, this question's for you, as what are some unique challenges to engaging public health end users as partners in vaccine research?
Thanks very much. I think the question is, public health end user is me, right? Is that how the question is intended to be? So I think that's a really important question. I think the biggest challenge is capacity. And I know that sounds so pedestrian in many ways, but it actually is capacity. So for us, one of the things that what is our role in decision making? So actually, this question from my perspective is related to what Manis said before. As public health end users, we have to be actually quite, especially decision makers, we have to be quite careful about engaging individual researchers, because an individual researcher will promote their research, quite rightly, I would, in the decision-making process. So for me, one of the biggest challenges is, how do we make sure that that middle step between us and the researcher is actually properly invested in? I don't know if most people know, but the National Advisory Committee on Immunization is largely a volunteer organization. When are we, sort of the work that Manish was talking about, how do we make sure that we actually invest in the people who can do that knowledge synthesis in a way that is a valued and properly resourced part of their job, so that those of us in public health can go forward with the work we have to do, which is make decisions about vaccines with confidence, knowing that it's not biased. And we can speak to our communities with the kind of confidence that both respects the importance of our independence from the research, but a complete understanding of what the research has actually said. And then certainly in COVID, I would like to say that one of the other things that was really important is timeliness, just timeliness. And again, we just actually recognizing knowledge synthesis and translation as a science within itself that requires similar investment as the front end, the primary research and the practice. And so I think those would be, to me, my biggest challenges. One of the other things that happened during COVID is it was a real challenge, apart from the traditional research components, to really bring the research effort to bear to a pandemic response in a way that is really so we're all pulling in the same direction. And I think it's because there are many other things that drive research, like, can you publish this? There's the competition of research. So that's the other thing is, for me, how do we bring research and practice that continue and make it happen? And again, as Manish said, we're actually incredibly lucky in British Columbia because we have the Vaccine Evaluation Center, but it's a pretty unique entity and much of the country doesn't have that. So thank you.
And as a knowledge translation coordinator, I am not biased at all by saying that I think that's something we should invest in. No. So I'm just looking at the time, and we have about 5 minutes left. So I think we'll get to one last comment before we start wrapping, or one last question before we start wrapping things up. And I think this next question actually ties into a question that Julia, also had in the Q&A, in terms of how can vaccine researchers better collaborate and engage with public health partners who have often been missing from the conversation. And that sort of ties in with Julia's question about what's the most significant challenges for this collaboration. So Caitlin, if you want to take the lead on that one, thanks.
Yeah, so when it comes to collaborating and engaging with patient partners and members of the public, I think something that I've been very mindful of over the last several years is that people aren't going to engage if they aren't aware that opportunities for engagement actually exist. It seems like a very basic thing, but that's something that I personally struggled with up until only a few years ago. For me, from quite an early age, I had this passion and this drive to use my healthcare experiences, both positive and negative, to help improve the care of patients going through the same types of things that I was dealing with. But even though I had all these ideas and ambitions, I had no idea how to actually bring those things into fruition. I didn't know how to make my voice heard. Luckily for me, I had one doctor at Children's who not only saw that drive and desire within me, but she had her own awareness of certain opportunities, such as the YAC, that would give me that kind of platform to share my experiences and ideas. And once I made that one connection and had that one opportunity for engagement, it has since blossomed into a world of opportunities that I never imagined I would have been involved in. So I think that's really the first step that researchers need to take, and that's exploring just how to make people more aware of opportunities to collaborate and to use their experiences to guide research goals. I think when it comes to patient partners specifically, a good place to start is to make clinicians aware of opportunities for patient engagement, because they, can help identify patients or families that may be interested or may be a good fit. Again, for me, despite seeing countless clinicians over the years, there was only one that helped me pursue patient engagement opportunities. And I imagine what it would be like if more clinicians were able to do that. Because yeah, like I said before, it helps both researchers and patients. When it comes to engaging the public, I think we have to be a little bit more creative. Most importantly, opportunities just need to be accessible. When we're talking about groups that are often left out of these conversations, we have to go to them. So again, I think a good place to start is to, and I think, Alistair, you touched upon this, is to explore the use of social media to promote opportunities, but also to collaborate with schools and universities or libraries, rec centers, clinics, whatever, any place that you can kind of start to make those connections. And then when it actually comes to holding discussions and workshops or any type of collaboration meeting, have virtual options. And, whether opportunities are surveys or small group discussions or larger group workshops, it's so important to kind of have that variety of engagement opportunities. I think if COVID has taught us anything, it is that variety and flexibility vastly improve accessibility and inclusion. And then I would say that the last thing, and possibly the most important, is that if you are going to ask for advice and opinions from the public, and especially from youth, actually listen to them and give credit where credit is due. I feel like if people aren't being listened to, or they feel like their efforts are redundant, they're likely not going to continue to engage. But if they actually feel heard and appreciated, they may very well become a valuable resource for a very long time.
Perfect. Thank you so much, Caitlin. So it looks like we're coming to an end here, and I think that's a really great way to end with what you've said there, Caitlin. I just want to say before I pass it back to Sterling, thank you all to our panelists for your contribution, not only to this conversation, but over the last, 2 years now with this project. And hopefully, well, definitely many more conversations to come in the future. So thank you again, and thank you for everyone who listened into the panel discussion. Sterling, back to you.
Great. Well, thank you all for that discussion and for the work that you've done. It's fabulous to see community and patient engagement in the development of the research agenda around vaccines in British Columbia. So a huge thank you for the efforts and the work that you're doing in moving that forward. I'd like now to just say that we're moving into a break. It's an opportunity to have lunch, but also to view the posters. So please use the e-posters tab to review the posters, as well as the networking tab to engage in discussion with colleagues who are present online at the conference. 1 o'clock sees us then back to the breakout session of 3. So please join us there. That's obviously Pacific time. And then 2 o'clock Pacific time, please join us for the closing session. This will be a celebration of the life of the late Pat Atherton. And it's also an opportunity for us to announce the winners of the Pat Atherton Emerging Scholar Award. So please ensure that you join us for that. And that's at 2 o'clock this afternoon. Thank you again, and I'll see you later on.